Welcome to Urology Unplugged, where we dive deep into common urological conditions. Today, we have the pleasure of speaking with Dr. Majid Adil, a highly experienced urologist with 25 years of expertise, who is professor and HOD, Department of Urology, DCMS, who trains postgraduates under him in the Department of Urology. Let's explore two prevalent issues, that is, benign prostatic hyperplasia and kidney stones. Dr. Adil, can you start by explaining what BPH is and what causes it?
Thank you for having me here. Good afternoon, everyone. The prostate gland is a small walnut shaped gland which is present below the bladder in all males. As a person grows older, usually beyond 50 years and up to 80, 85, whatever, the prostate gland starts enlarging, and that's where the problems start. So, a prostate gland is a part of aging. The growth of prostate is part of aging, but definitely it needs to be followed up and treated if required.
Who is more likely to develop BPH?
All males have a prostate gland, like what I said, but about 50% of males above 50 years of age can start developing an increase in size of prostate. They may not have symptoms, but by the age of probably 75 to 80, almost 80% of males will have increase in size of their prostate glands, and most of them will start getting symptoms also in the later age.
What are the typical symptoms of BPH?
BPH can present with a variety of symptoms. In the sense, there are symptoms of storage and symptoms of voiding, what we call as. The patient may have frequency, matlab बार बार यूरिन के लिए जाना. Urgency, once the person gets the feeling of full bladder, he has to rush to the toilet. A lot of them always say that they're all right if they're outside somewhere, but once they come back to the house, or are they if they're near the toilet, or if they see the WC, suddenly they start feeling the very urge, a high urge to urinate. And this we call as precipitancy, and some of them leak urine also, which is called as urge incontinence. So all these are symptoms of storage in a patient with BPH. They may also get symptoms like getting up to pass urine repeatedly in the night, what we call as nocturia, रात में बार बार उठ के urine के लिए जाना. And when they go to pass urine, they may not get the stream immediately, what we call as hesitancy. मतलब जाके they try to pass urine, but it will not come immediately. So they have to wait for a long time and then it starts. So hesitancy. And when they pass also, the stream will be poor and slow. And once they pass and come back, they will get this sensation that I have not emptied my bladder. So that feeling of incomplete emptying or incomplete voiding is also a symptom of
BPH.
voiding and BPH.
How does BPH affect a person's quality of life?
It does. With initial symptoms, mild symptoms like frequency, hesitancy, they tend to be all right. But when the symptoms increase, like severe frequency, so people almost stop going outside for the regular work or regular activities. Then waking up in the night repeatedly, sleep gets disturbed. So you don't sleep well, so whole day you're drowsy. So these type of people also tend to be socially, they tend to recluse themselves. So there are symptoms which cause definitely affecting the quality of life in a person with BPH.
What are the common diagnostic tests for BPH?
For a regular person who comes with symptoms to any urologist or a physician or a doctor, the first test which can be done and easily done is first is history. You have to take proper history and ask all these symptoms which I've mentioned. Plus nowadays we have a BPH questionnaire. Means there are few questions are there. Usually they can fill up those saying, "Mujhe ye ho raha hai, this is what I'm getting frequently, this is not what I'm getting." So in that we call it prostate symptom score. So symptoms pehle you have to take. After that you do a digital rectal exam where you examine the prostate clinically whether it's enlarged or not. Next to that will be a simple urine examination, which is commonly done in all labs. After that, we do a blood test which is called as PSA, prostate specific antigen. This is very important because PSA will, if the PSA is high, then it differentiates a person with BPH from a person with cancer also, or a person with infection of prostate. So to differentiate these two symptoms or these two conditions, we have to do a PSA also. Then we have other tests like ultrasound, where we get ultrasound of the abdomen done, and then we tell the patient you have a full bladder. They will check it, and then after passing in, whether any amount of urine is remaining behind, and then what is the size of the prostate? Is it too much bigger compared to a normal prostate? These are the tests which we do. We also do a test called uroflowmetry, which will show the stream of the urine, how the urine goes. If the urine stream is normal, like a normal person, it is slightly obstructed or very severely obstructed. All these give us a picture as to what type of treatment is ideal for that particular person. An advanced test also is there, which is called as a urodynamic study, where we have to insert a slightly invasive test, where we have to insert catheters and then see if the prostate is causing the problems, or in some diabetics bladder mein khud weakness hota hai, so bladder will not be able to push the urine out of the urethra and the prostatic part of the urethra. So whether bladder weakness is there. So in some patients where this type of bladder problem, what we call as diabetic cystopathy, or any neurological problem having bladder issues, is suspected, where we do a urodynamic evaluation also.
What are the treatment options for BPH?
BPH has simple treatment options, in the sense like we can give medications, first thing. Second thing is slight lifestyle modifications. So these are the two main categories of treatment where most of the patients are happy with this. We have two main categories of drugs which are called as alpha blockers. Initially we used to have very few choices in alpha blockers, but now we have a wide variety of alpha blockers. If we start with the one type of alpha blocker, if it doesn't work, we can change to another type also. And then we have the other type called 5-alpha reductase inhibitors. These are enzyme inhibitors which reduce the size of prostate. So alpha blockers will open up the prostate, and 5-alpha reductase inhibitors will reduce the size of the prostate, and both of them will help in alleviating the symptoms of the patient who has troublesome symptoms of BPH. And the other option which I said is lifestyle change. As if the patient can reduce his fluid intake in the night, then the lot of times which he has to go for urination, he need not go. Daytime he can take, but night he can reduce the fluid intake. Sodium intake, if it can be reduced, it is good for him. Then if patients with diabetes, hypertension, that should be under control. And dietary habits also. If they are like drinking too much of liquids, cool drinks in the night, all those caffeine intake during evening time, night time, can cause more symptoms of BPH. So these type of changes, if they are done in the day-to-day life, it definitely helps a person.
So lifestyle changes can also help us manage BPH.
Absolutely, lifestyle plus medications.
Can BPH be prevented?
Prevention of BPH, see, BPH is a part of growing up, like what you said, it's physiology which is part of aging. But you can do some lifestyle changes, like you avoid taking too much of sodium, and have good hydration during daytime, and then visiting a doctor for symptoms and making sure that other kinds of problems are not there. These type of things can be done to prevent BPH. But as such, BPH can be prevented. The symptoms may be alleviated by some changes in lifestyle. Regarding treatment, there are other options also, like surgical options, what we call a minimally invasive surgery called TURP, transurethral resection of prostate, where no cut is given, no holes are made in the abdomen. A small scope is inserted through the urethra, and the prostate is removed from the urethra itself. So patients are up and about on the same day, and they have a catheter for 1 or 2 days, and then that can be removed, and patient will be free of symptoms.
So we got to know about BPH a lot, I guess, and we have a clear idea of what BPH is.
Yeah.
Now,
there are a lot of things more about BPH, but to keep it brief, these are the main guidelines which we have to follow to have a lifestyle which is not affected by BPH in older males.
now that we have concluded with the benign prostatic hyperplasia, let's move to kidney stones. So what are the kidney stones and what causes them?
Kidney stones are hard calcified deposits within the kidney. They form because of aggregation of salts like calcium, oxalate, phosphates, triple phosphates, etc. And these are formed by mainly these are hereditary, meaning if the parents have stones, their offspring can have stones, the children can have stones. That I feel is the most common factor. Apart from that, high sodium intake, diabetes, hypertension, these are the things which can cause kidney stones.
We would like to know about the symptoms of kidney stones. What are the symptoms of kidney stones?
A person with small kidney stones somewhere in the kidney may not have any symptoms. That is the first thing we have to remember. But if these stones start obstructing the kidney by coming down into the ureter or part of the kidney by being in the outlet of the kidney, then these persons may present with pain, vomiting, and this pain is typically called loin to groin pain, which starts from a right or left side of the back and goes down to the pubic area. So this type of pain may occur. Some of them may get present with fever also, especially if the kidney gets infected. They may get present with fever, chills, rigors. Some of them may present with hematuria, which is nothing but blood in the urine. And if these are the symptoms, then they have to consult a doctor and take treatment.
Do kidney stones always require surgery?
No, most stones, especially if they are small, they stay in the kidney, in one corner of the kidney, and they will not require any surgery, no procedure, and they don't cause any harm. We may give some medical management which may dissolve those stones or may not. But if the stones come down, they may give symptoms. And a lot of times, even they don't require surgery because they tend to pass off. By good hydration, patients should take good amount of oral fluids. Some medications also are there which open up the ureter and the tubes where they get stuck, and then they can pass off. But stones which are stuck for a long time, blocking the kidneys, giving severe pain, then and if they're not passing by medical management and other lifestyle changes, then they require surgical procedures like extracorporeal shockwave lithotripsy, which is giving shocks from outside, which is nowadays quite obsolete because we don't do it much. Apart from that, we have procedures like ureteroscopic lithotripsy, where a small scope is introduced into the ureter, the tube which is draining the kidney, and that is broken. Or we can make a small direct puncture into the kidney, and even big stones are removed from the kidney doing a PCNL. Or we have nowadays the newer option called RIRS, retrograde intrarenal surgery, where the kidney stone is removed not even by a puncture but by a direct access through the normal urinary tract. So there are various options to remove kidney stones, but a lot of times they don't require surgery, especially if they are small and passing out.
How much fluid should a person drink to prevent kidney stones?
A good amount of fluid, which is supposed to be healthy for a patient, for any person for that matter, is about 2.5 liters, but it can go up to more if in hot summers like how we get in tropical countries like India. So I would rather put it the other way. A urine output of about 1.5 or 1.8 liters is good for any individual. For that, in summers you may have to take about 2 to 2.5 liters. In winters you may have to take 2 to 2.5 liters, and in summers it may have to go up to 4.5 to 5 liters also. So a good output of 1500 to 2000 ml is good in a patient.
What can be done to help prevent the recurrence of a kidney stone?
This is misconception that a person who gets a stone will always get another stone, especially if a procedure is done. This is not true, because some people have a stone sometimes in a lifetime and they'll never get a stone after that. But a lot of them have tendency to form stones recurrently or repeatedly, and some may have a lot of stones at one point of time itself, and they keep coming down and troubling the patient. So if a person has got kidney stones, there is a likely chance they may get a stone again. Definitely from a normal person, a person might get a stone again. That is quite possible. But we can avoid or prevent stone formation by keeping ourselves adequately hydrated, like what we discussed just now, adequate amount of oral fluids. Then another thing is keeping the sodium intake low. Salt causes increase of kidney stones. Maintaining weight, obesity can cause kidney stones. So maintaining good weight, doing regular exercises with good hydration again, not getting dehydrated during exercises, and maintaining good health and keeping weight in check can help in reduction of kidney stones. Keeping sugars under control will help in reduction of kidney stones. And dietary habits, I don't believe they play much of a role, but definitely oxalate rich food, if it can be avoided, over excess of calcium can be avoided. These can help in preventing kidney stones. But at the same time, let me tell you, there is calcium in milk. So people can take milk. A lot of people avoid milk totally. That's not good because that can have an adverse impact on health. So 150 ml of milk a day is good for health because some amount of calcium intake is necessary for good maintenance of the body and to prevent kidney stones as well. Muscle, bone, everything. So there should not be drastic reductions of dietary restrictions for kidney stones. But the other things like what I said just now will help.
What about the protein intake in kidney stones in the prevention of recurrence of kidney stones?
Protein intake definitely, reduction in protein intake definitely helps in reduction of kidney stones. But again, like salt and calcium, some amount of protein is required, which is can be vegetable protein or animal protein. But reduction in protein intake definitely helps in reduction of kidney stones.
Thank you, Dr. Adil, for your valuable insights on BPH and kidney stones. Before we wrap up, let's address two myths on BPH and kidney stones. So the myth regarding BPH is it is normal part of aging and it does not require treatment. Is it true?
BPH definitely is normal part of aging because like I've said earlier, all males above a certain age can have an increase in prostate size, but it doesn't require treatment and you have to ignore BPH is not true. Of course, BPH can cause complications, like it may give rise to, it has like what we said, lifestyle problems. That is one thing which has to be treated medically or surgically. And sometimes BPH can cause other problems, like if it goes on for a long time, chronically patients are in retention, then it may affect the kidneys also. So it is always better to have a check on your prostate after a certain age, and if there is back pressure changes of the kidneys, the creatinine goes up, renal failure starts. So to prevent all those, there has to be some kind of treatment in patients who go into complications or who have too many symptoms of BPH. So it is a part of aging, but it may require treatment at some point of time in some individuals.
Kidney stones affect people who eat too much of salt. Is that true?
Partly true, but I've mentioned earlier, like kidney stones are, I always tell my patients that a lot of times you're born with some problems which are bound to happen. And even renal calculi or kidney stones are like that. A lot of them are hereditary, but definitely once you know that you have kidney stones as a problem in your health, then it's better to have some dietary restrictions like salt restrictions, lifestyle changes, non-veg restrictions, etc. But only salt will cause kidney stones, that's a myth. That doesn't happen.
Thank you, Dr. Majid Adil, for taking your time and sharing your expertise with us today. Indeed, it is very much valuable to our listeners who are dealing with BPH and kidney stones.
Thank you.
Remember, if you suffer from kidney stones and if you have persistent urinary symptoms, do not hesitate and talk to our urologist like Dr. Majid Adil.